I wanted to make sure that the simulation would be challenging. That was one key objective, so that it would be engaging and challenging and push the students' learning. Secondly, I wanted a simulation that met and reinforced key learning objectives from the entire program. And I was particularly interested in finance and accounting, human resource, and strategy. Those are three areas of skills that are very important for our students. They're reflected well in our MHA curriculum. For example, we have 3 courses that have to do with managerial accounting and finance. But also I wanted them to be able to have an experience to build, practice their evidence-based decision-making skills. That's a key theme that runs throughout the entire program. So I wanted a simulation that would be data-based, that would give them a lot of data to analyze, to think about in order to, and then make decisions on the basis of those data and those analyses that they would do. Again, in the areas of human resources, financial management, and strategy. But in addition, there are some particular areas of healthcare that I wanted them to be aware of while that would be built into the simulation. And that includes quality of care, patient satisfaction, achieving sustainable financial outcomes. And in other words, I wanted them to be able, the simulation to reflect not only the business skills, but some of the key issues that students and leaders will find in the US healthcare system right now. So quality, patient satisfaction, access to care, cost of care, and also there's a growing emphasis on healthcare systems that look outward toward the community, toward prevention, and toward dealing with social issues that their communities face, and also focusing on primary care. So we put all of those elements, we built all of those elements into the simulation. The fundamental system that we're asking our students to manage as a top management team, right? They're working in teams of 3 to 5 people. They're imagining that they are the top decision makers. The system that we're simulating is a general community healthcare system. It has a hospital, a main hospital with inpatient care, an emergency room, very active one, and outpatient clinics. Those are the fundamental service lines in the community hospital that we are simulating. And then, as I say, in addition, and as you're reminding me, then we brought in the opportunity for the students to acquire, for the healthcare system to acquire primary care, so that they end up, by the end of the game, managing 4 different service lines. And in addition to that, having to deal with prevention programs in the community for the opioid epidemic.